Hi everyone, Dr. Amy from Pain Free and Fit. Today, part 2 in our series on band exercises for shoulder impingement and arthritis pain. Hope you enjoy. In part 1 of this series on band exercises for shoulder impingement and arthritis pain, we talked about correcting an anterior glide syndrome. And we mentioned that shoulder impingement and arthritis pain is many times aggravated by mechanical factors, both of the shoulder blades, such as rounded shoulder tendencies, tipped shoulder blade postures, tendencies to abduct or downward rotate or wing the scapula or shoulder blade, as well as upper arm problems, such as an anterior glide syndrome, where as you're moving your arm, the upper arm doesn't stay centered in the socket but glides forward. Today, we're going to be talking about another upper arm problem, which is called superior glide syndrome, that aggravates both shoulder arthritis and impingement pain. Upward or superior upper arm glide is when, as we raise the arm in any degree, but especially sideways or laterally, the upper arm has a tendency to shift or slide upwards in the shoulder socket as opposed to being maintained in the centered position. Normally, as the arm comes up and the shoulder blade moves out to assist in the motion, that upper arm should stay centered in the shoulder socket. Because of rotator cuff weakness and asymmetry and bad movement habits that have developed over many years, the upper arm has a tendency to slide upwards, contributing to impingement pain as well as arthritis pain in the shoulder. So one of the first lessons we do without a band to prep us for the band work is we practice putting our shoulder blade into a neutral position, meaning avoiding any rounding or tipping or winging. And we're going to practice just tensing our upper arm down in the shoulder blade. Now be careful, you don't want to push your whole shoulder blade down. So if you feel around your back to the base of your shoulder blade, remember the shoulder blade is a triangle, so you want to get down to the very tip of it. As you move that upper arm slightly down or tense it down, you don't want to feel your whole shoulder blade shifting down into your finger that's monitoring the base of the shoulder blade. It's a very slight motion, maybe an 1/8 of an inch, a 1/16 of an inch. Once you get that idea of shoulder down in the socket, just a little tension, and you can feel that at the very corner tip of your shoulder, when you're doing it right, you're going to notice your shoulder moves slightly down away from the end of your collarbone. You can do that at different angles, with the arm forward, with the arm sideways, with the arm overhead. It helps to identify which particular point in your arm's motion is most painful and practice it there. You can even passively hold on to something as you practice that slight downwards tension. Again, it's very slight. You don't see me moving much. It's a very slight tension of my arm moving down in my shoulder socket. Again, I can feel the bottom of my shoulder blade to make sure I'm doing that correctly. So I'm localizing it to the arm and the socket, and I don't feel my whole blade pushing down to my finger. Once you have that downward, it's time to use the resistance band. Affix a band above where you're standing and roll your arm right through it. You want to position it so it's about 2 inches from the center of your armpit, so it's close to that upper arm. And again, at different angles or different levels, you can feel the back of your shoulder blade with your other arm to make sure you're not pushing your shoulder blade down, and practice tensing that upper arm down in the socket. You can do this for repetitions, building up to 50 to 100 reps. You can also do it for isometric holds, where you press down and hold for extended periods. It's important to do this at different angles of arm motion, so you practice the motion and the rotator cuff gets used to tensing at different unique angles. And again, if you have a particular angle that's most painful, that's the angle you want to work at. Including these band exercises in your self-rehab, self-treatment routine at home or the gym is a great way to overcome shoulder impingement and arthritis pain. If you like this video on shoulder impingement and arthritis pain with band training, feel free to subscribe to our channel. We've got a lot of great videos out there to help you. Questions or comments, write in. As always, I'll do my best to answer them. Thumbs up to help me share this valuable information with others. And remember, if you're looking for a way to analyze your shoulder mechanics, build a step-by-step tailored program to help correct your dysfunctional mechanics, get your shoulder pain back in shape, and avoid aggravation, check out our shoulder pain healing exercise program available at painfreeandfit.com. I hope this video on band exercises for shoulder impingement and arthritis pain helps you with your shoulder issues.